Hello and welcome. Thank you for joining me today. In this video, we are going to talk about something very important for your health and well-being. We will look at 7 common medications that older adults need to be careful with. These medicines are often used for pain, sleep, anxiety, or other problems, but as we get older, our bodies change. This means some medicines can work differently or cause more side effects than they used to. Taking the wrong medicine or taking too much of it can cause problems. You might feel dizzy, confused, sleepy, or even fall and get hurt. You might feel weak or have problems with your heart, your kidneys, or your brain. Sometimes these problems can be serious. The good news is, you do not have to face this alone. You can talk with your doctor or your pharmacist. They can help you understand your medicine and make sure it is safe for you. And by watching this video, you are already taking a big step to stay informed and protect your health. Let us get started with the list of 7 medications seniors should be careful with. The first group of medicines to be careful with is called benzodiazepines. These medicines are used to help with anxiety, panic attacks, and sleep problems. Some common names are diazepam, which you might know as Valium, and lorazepam, which is also called Ativan. There are others too, like alprazolam and clonazepam. These medicines can make you feel calm and sleepy. That sounds helpful if you are feeling nervous or having trouble sleeping, but in older adults, these medicines stay in the body longer than they used to when you were younger. This can cause problems. Benzodiazepines can make you feel very sleepy or dizzy, especially during the day. They can affect your memory, your balance, and how clearly you think. This makes it more likely that you could fall or have an accident. Even small doses can cause confusion in older adults. For example, if you take lorazepam at night to help you sleep, you might still feel groggy in the morning. You might feel like your head is cloudy, or you cannot think clearly. You may also forget things more easily. Some people even start to feel depressed or irritable. There is also a risk that your body gets used to the medicine. This means over time it may not work as well, and you may need more to get the same effect. That can lead to dependence, which means your body thinks it needs the medicine to feel normal. Stopping suddenly can cause strong withdrawal symptoms like shaking, sweating, or feeling panicked. So what can you do if you have anxiety or trouble sleeping? There are safer choices. For anxiety, your doctor might recommend talking therapy or other medicines that are safer for long-term use. For sleep, simple changes in your bedtime routine can help. For example, go to bed and get up at the same time each day. Keep your bedroom quiet and dark. Do not drink caffeine or alcohol close to bedtime. Sometimes a short-term use of a benzodiazepine may be okay, but always talk with your doctor before starting or stopping any medication like this. Now let us move on to the second group of medicines to be careful with. These are called anticholinergics. That is a long word, but do not worry, I will explain it. Anticholinergics are found in many over-the-counter and prescription drugs. They are used to treat allergies, colds, motion sickness, depression, and even bladder problems. One common example is diphenhydramine, which you might know by the brand name Benadryl. It is often used for allergies or as a sleep aid. The problem with these medicines is that they block a chemical in the brain called acetylcholine. This chemical helps with memory, learning, and muscle control. When this chemical is blocked, older adults can experience confusion, memory problems, dry mouth, blurry vision, constipation, or trouble urinating. Some people feel dizzy or have trouble focusing. If you are already having memory problems or early signs of dementia, these medicines can make things much worse. Let us take diphenhydramine as an example. It is in many nighttime pain relievers and cold medicines. People take it to sleep better. But in older adults, it can cause next-day drowsiness, confusion, or trouble walking steadily. This can raise your risk of falls and broken bones. Another anticholinergic is oxybutynin, which is sometimes used to treat overactive bladder. It can also cause similar problems like dry mouth, constipation, and confusion. Again, these effects are stronger in older people. So what can you do? If you have allergies, talk with your doctor or pharmacist about safer options. There are newer allergy medications like loratadine or cetirizine that do not have strong anticholinergic effects. They are much gentler on the brain. If you take sleep medicine that contains diphenhydramine, consider stopping or asking for a different solution. Often, better sleep can come from lifestyle changes like limiting screen time at night, avoiding caffeine, and keeping a regular bedtime. Let us go on to the third group of medications. These are NSAIDs, which stands for non-steroidal anti-inflammatory drugs. These are used for pain, swelling, and fever. Some common ones are ibuprofen and naproxen. You may recognize brand names like Advil, Motrin, or Aleve. These drugs can be helpful for short-term pain, like a headache or a sore knee. But when taken often or for a long time, they can be dangerous for older adults. First, they can irritate your stomach lining and cause ulcers or bleeding. This can happen even if you do not feel any stomach pain at first. The bleeding can be slow and hard to notice until you feel weak or dizzy. Second, NSAIDs can raise your blood pressure and make heart problems worse. If you already have heart disease or high blood pressure, these drugs can make things riskier. Third, they can reduce blood flow to the kidneys. Over time, this can cause damage, especially if you already have kidney problems. To give an idea of how much can cause problems, just taking 2 tablets of ibuprofen, 400 mg each, 2 or 3 times a day for several weeks, can raise your risk of bleeding or kidney trouble. That is the amount many people take for arthritis or back pain. What are safer options? For mild pain, acetaminophen, also called paracetamol or Tylenol, is often a safer choice. But even acetaminophen should not be overused. The recommended limit is about 3,000 to 4,000 milligrams a day. That is about 6 to 8 regular strength tablets. Taking more can hurt your liver. For ongoing pain, talk with your doctor. Physical therapy, exercise, heat or cold packs, or other treatments may help. You do not have to rely only on pills. The fourth medication seniors need to be careful with is sleeping pills, especially a group called non-benzodiazepine sleep aids. One common example is Zolpidem, which you might know by the brand name Ambien. Others include Esopicolone and Zaleplon. These medicines are used to treat insomnia, which is when you have trouble falling or staying asleep. At first, they may seem helpful. You take a pill and you fall asleep. But for older adults, these medicines can be dangerous. Even though they are not benzodiazepines, they work in a similar way in the brain. They make you sleepy, slow your reaction time, and affect your balance. This is especially risky at night. If you get up to go to the bathroom, you might feel dizzy and fall. Some people sleepwalk or do strange things in their sleep that they do not remember, like cooking or driving. Zolpidem stays in the body longer than you might think. Even if you take it at bedtime, you may still feel groggy or confused in the morning. This can make driving or making decisions unsafe. In older adults, the effects can last even longer than in younger people. For example, one standard dose of Zolpidem is 5 to 10 milligrams. In older adults, even 5 milligrams may be too much. Imagine this like drinking 2 glasses of wine before bed and still feeling the effects in the morning. That is how your brain may react. There are safer ways to manage sleep problems. Instead of taking sleeping pills, try building better sleep habits. Go to bed and get up at the same time every day. Avoid naps longer than 30 minutes in the afternoon. Keep your bedroom quiet and dark. Avoid using phones or screens before bed. If you are still having trouble sleeping, talk with your doctor. They may suggest a lower dose, a different medication, or a short course of sleep therapy, which helps you change habits that affect your sleep. Now let us talk about the fifth medication on our list. This group is called antipsychotics. These are medicines used to treat mental health conditions like schizophrenia or bipolar disorder. They are also sometimes used for severe depression or behavior problems in people with dementia. Some examples include risperidone, quetiapine, and olanzapine. These medicines are very strong. They affect chemicals in the brain and help control severe symptoms like hallucinations or paranoia. But in older adults, especially those with memory problems or dementia, these medicines can cause serious side effects. Antipsychotics can cause drowsiness, confusion, and balance problems. They can also raise the risk of stroke, pneumonia, and heart problems. In people with dementia, these drugs may increase the chance of death. For example, risperidone may be given in doses from 0.25 to 2 milligrams. Even a low dose like 0.5 milligrams can cause side effects like stiffness, shaking, or low blood pressure in older adults. It is like turning down the volume on your brain's control panel. Things move slower, including your thinking, your walking, and even your swallowing. Sometimes these drugs are given to calm someone who is agitated or aggressive. especially in nursing homes. But they should only be used when other options do not work. Behavior problems may be caused by pain, infection, hunger, or boredom, and these should be checked first. If your loved one is on an antipsychotic, ask the doctor why it was prescribed. Ask if it can be reduced or stopped over time. Sometimes simple things like music, exercise, or talking with a friend can help reduce agitation without using strong drugs. Now let us move on to the sixth medication. This group is called muscle relaxants. One example is cyclobenzaprine, which is used for muscle pain or spasms. Other names include methocarbamol and carisoprodol. These drugs are sometimes prescribed after an injury or for back pain. They work by relaxing the muscles and making you feel more comfortable. But they can also make you feel very sleepy, dizzy, or confused. Muscle relaxants act like a blanket on your nervous system. They slow everything down. In older adults, this can cause problems with balance, memory, and clear thinking. They can also interact with other medications and make side effects worse. Cyclobenzaprine, for example, is usually given in doses of 5 to 10 milligrams. But for someone over 65, even 5 milligrams can make you feel like you took a sleeping pill. You may have trouble getting out of a chair, walking safely, or remembering what you were doing. There are safer ways to deal with muscle pain. Stretching, gentle massage, hot or cold packs, or physical therapy can help. Acetaminophen may also be used safely in many cases. If a muscle relaxant is needed, it should be for a short time only, and at the lowest dose possible. Now we come to the seventh and final group of medications. These are diabetes medications that cause low blood sugar, or hypoglycemia. A common example is glyburide, which is a type of sulfonylurea. Others in this group include glipizide and glimepiride. These drugs help lower your blood sugar by making your pancreas release more insulin. But in older adults, they can sometimes lower the blood sugar too much. This can lead to dizziness, weakness, sweating, confusion, or even fainting. Low blood sugar is dangerous. It can happen suddenly and may be hard to recognize. In severe cases, it can cause falls, accidents, or even loss of consciousness. Older adults may not feel the usual warning signs, and this makes it even more risky. Let us take glyburide as an example. It is often prescribed at doses of 5 to 10 milligrams per day. But even 5 milligrams can cause blood sugar to drop too low in some people. Imagine this as your body's fuel tank suddenly going empty without warning. You might feel fine one minute and collapse the next. If you have diabetes, there are other medications that may be safer for older adults. Newer drugs like metformin, DPP-4 inhibitors, or SGLT2 inhibitors are often used because they do not usually cause low blood sugar. Your doctor can help choose the right one for you. Also, checking your blood sugar regularly, eating balanced meals, and being careful with exercise can help you stay safe. So let us review the 7 medications we talked about today. 1. Benzodiazepines like diazepam or lorazepam, which can cause sleepiness, confusion, and falls. 2. Anticholinergics like diphenhydramine, which can affect memory and thinking. 3. NSAIDs like ibuprofen or naproxen, which can cause stomach, kidney, and heart problems. 4. Sleeping pills like zolpidem, which can cause grogginess and confusion. 5. Antipsychotics like risperidone, which can raise the risk of stroke and death in dementia. 6. Muscle relaxants like cyclobenzaprine, which can make you sleepy and dizzy. 7. Diabetes drugs like glyburide, which can cause dangerously low blood sugar. If you are taking any of these medications, do not panic. Do not stop taking them on your own. Talk with your doctor or pharmacist. They will help you understand if the medicine is safe for you or if something else might work better. The most important thing is to stay informed and ask questions. Always keep a list of your medications. Bring it to your appointments. Ask if there are any interactions or side effects you should know about. And if something does not feel right, speak up. You know your body best. Thank you for watching this video. Your health matters, and taking charge of your medicines is one of the best ways to stay strong and safe as you age. If this video helped you, share it with someone else who might benefit. Take care and be well.